I think our live yeah. Okay, so yeah. I-on ko lang yung live para sa kay Rainiel. Ay kay ano kay sino ba si Adrian kasi sabi ni Adrian recorded daw dapat.
Okay.
Okay. Okay na. Okay, good. Can you guys see my presentation?
Yes, sir.
Yeah, okay, okay. It's shared. All right. Adrian, you're welcome. Okay. So now let's move on to our discussion on the specific viruses. So I think this will be the last one I think this will be the last discussion about viruses, specifically the lecture on um, our lecture on virology. So adenoviruses. Let's talk about adenoviruses. Adenoviruses are named because they were isolated from the first organ of isolation is the adenoids. Wonderful, wonderful trivia for you guys. It's a wonderful trivia. Now, how many serotypes of adenovirus is known, and how many are of clinical importance to man? Well, there are actually 50 serotypes, and we only need to remember that there is two clinically important adenoviruses. All right? Out of the 50 ones that have been isolated by a lot of scientists, or out of the 50 serotypes that have been isolated by virologists throughout history, two of those are of clinical importance. All right. Now, what serotypes are clinically important? Now, this is now going to be the nitty-gritty of our discussion. Why? Because guys, we need to remember the numbers of the serotypes. So please don't forget serotype adenovirus serotype 40 and 41. They're they're in they're almost it's easy to remember mainly because they're they follow each other. So 40 41, and this one causes or this serotype causes infantile gastroenteritis. So please don't forget that one. Those two adenoviruses. Now let's move on to the family of arena viruses. Now, arena viruses are clinically important viruses, and there are two of them that are under the there are two viruses under the arena virus family or the arena viridae. We have what you call the we have what you call the Lassa virus and the lymphocytic choriomeningitis virus or the LCM virus. Okay, the Lassa virus, for your information, was first discovered in Lassa, Nigeria. Just just so we can get a little bit of information for that one, so we can milk a little bit more of information. Now, the transmission of arenaviruses are usually transmitted by rodents, specifically the rodent excreta. It's not the rat bites, it's not the rat fleas, but actually the rat feces. Okay? So they are zoonotic infections. Okay, so arenaviruses are zoonotic infections. All right. So based on clinical presentation, what's the difference between Lassa virus and the LCM virus, or the clinical presentation of the infections caused by these two viruses? Well, Lassa virus causes hemorrhagic fever, similar to that of what? Of dengue virus, dengue hemorrhagic fever, right? And LCM, from the name itself, it's basically a septic meningitis. Okay? Now, moving on to Bunion viruses, the structure of the Bunion virus genome. Again, it's a repeat question from a couple of slides back. What is the structure of a Bunion virus? Anybody on the chat? What is the structure of the Bunion virus genome? Let's try to call out people from the chat room. Let's talk to Myra. What is the structure of the Mayra, sorry, Mayra. What is the structure of the Bunion virus genome? Chat, or you can put it in, you can unmute yourself. It doesn't really matter. Anybody? All right, let's try another person. Charisse. Charisse May.
Circular, sir.
Circular. Wonderful, wonderful, Mayra. Thank you before I move to Charisse. Thank you for participating. All right. Now, let's move on to the it's it's helical, and the structure, the pattern is circular. Now, the origin for the name of the Bunya viridae family is that it was first discovered in Uganda, specifically Bunyamwera, Uganda. Please don't forget Bunyamwera, Uganda. Okay? Now, what are the two divisions of viruses under these ones? We have two divisions, arbovirus and non-arbovirus. What's the difference between an arbovirus and a non-arbovirus? Well, an arbovirus is transmitted by an insect vector, all right? And a non-arbovirus is transmitted by not by it's transmitted by what? Not a vector. Of course, that's the difference between them. All right? Now, what are the viruses, what are the insects, or rather arboviruses that are transmitted by insects? So what are the arboviruses under the Bunya viridae family? So there's two actually. The lacrosse virus and the Californian encephalitis virus. Now you're gonna ask me, sir, I thought the Bunya viridae family was first discovered in Bunyamwera, Uganda. Why is there a Californian encephalitis virus? Well, it was first discovered. The family of those viruses was first discovered, but again, throughout history they still discover that there's some viruses that are related to the Bunya viridae family, and that's how they named it: encephalitis virus, the California encephalitis virus, and the lacrosse virus. Okay, so those are the arboviruses that are transmitted by insects. Now let's talk about hantavirus. Hantavirus is the only virus under the Bunya viridae family of clinical importance to man that is that is a non-arbovirus Bunyaviridae family. How is it transmitted then? It's a zoonosis. Again, rodents.
Rodents.
Okay? It's a zoonotic infection. It's transmitted by rodents again. Inhalation of aerosolized excrement. Viral aerosolite of inhalation of aerosolized viral virions in the rodent excrement or feces na lang, just to be sure. All right, the virus under the hantavirus genus, which causes hemorrhagic or kidney disease, is known as the Sinombre virus. The Sinombre virus. Okay, so many things to remember, but unfortunately, a lot of the questionnaire, we don't know many of the questions, so memory work, guys, memory work. Caliciviridae. Let's talk about Caliciviridae. By the way, do you see the pattern, guys? I'm talking about the viruses from A to V of clinical importance. I don't take credit of the data that I'm presenting. Not the data, the information that I'm presenting to you. These are all compiled notes from when I was studying and from uh from my graduate years, I think. Yeah, after I graduated, I still took another exam, and this were basically just compiled notes. So again, I don't take credit for this one. I'm presenting it to you guys in a manner that is somewhat digestible, because when you look at the books, I know when you look at the books, especially when you're studying for an exam, some of it is just a bunch of jargon. And I want you guys to at least try to be mindful of the questions that might be presented to you. And so I I gave it to you guys in flashcards and presented to you in a chronological order. So in such a way so that in so that when you're reviewing, maybe you're in the bus, you can just you can just uh you can just swipe the notes up and down and challenge yourself. Oh, I forgot this one. Then maybe for some hope or miracle, these questions might be asked of you, and when you take the exam, when you take an exam. So hopefully, guys, fingers crossed, one of the questions here would be helpful for you. All right. Now let's continue. Caliciviruses. Caliciviruses, the viruses under that one is, of course, please let's not forget, I mentioned it before, the Norwalk virus and the HEV virus. All right. The origin for the name given to the Norwalk virus, I know, guys. We don't need to know the origin, but I just want you guys to at least have some sort of tidbits of information. Maybe you can use it as a mnemonic or whatever. Okay, so it was discovered in Norwalk, Ohio. All right, so in America, HEV has now been reclassified. This is a recent this is a recent edit from my previous notes. HEV is now reclassified in its own genus. Actually, it's now known as a Hepeviridae family, not herpe, ha, Hepeviridae, hepatitis E viridae family. So it's no longer under the Callici viruses, but it has its Callici viridae family, but now it has its own. All right, Hepeviridae family. I know, so much stuff to remember. I know. I'm terribly sorry, guys. I'm just the presenter. All right. Which viruses has the same clinical presentation as HEV? Of course, let's not forget it's hepatitis A. It's hepatitis A, guys. What's the difference? HEV is much more fatal for pregnant women. That's the main difference. That's the reason why pregnant women here in the Middle East, they're always tested for hepatitis panel. I know it's not uncommon in the Philippines, especially if you live or if the economic status of the family is somewhat of that in the um, less fortunate people, less fortunate economic standing. Here in the Middle East, they test for all serological markers actually that is available in one particular region. And when I first arrived here, I was I was I was shocked because for a routine checkup for a lady who for a pregnant woman in her first trimester, one of the tests is full serological panel. So it tests everything. So from hepatitis A to D, and then all the other STIs, and also culture and sensitivity for Neisseria and other things that might affect the conditions of the baby. So what I want you guys to remember is that although we live in a country in the f- in we live in a country that doesn't provide that cannot provide sufficient healthcare for most of the population. I suppose we can look at the other countries on how they treat their patients in order for their patients to survive. So the takedown of this is that each country has their own healthcare protocols, or rather, um, tests when it comes to maternal and child health. So hopefully, when you guys are in the practice, you will not be flabbergasted by the amount of tests other people from other countries are being tested. Because when I first arrived here, I had no idea. 'Cause when I was in the Philippines, we only just test for syphilis and then HIV and hepatitis B and A. I didn't know that there was a full serological screen for pregnant women before they come into what they call full term pregnancy. So yeah, hopefully you guys would remember this lecture, and oh my gosh, I remember Sir Manuel told me about it a couple of years ago. Oh, diba? I'm inviting you guys into practice na. All right, let's move on to the transmission of the Callici viruses. Callici viruses are transmitted by fecal oral route. All right, fecal oral route. All right, now let's move on to the coronaviruses. Okay, coronaviruses, the origin of the group is based on the structure that is observed using the electron microscope. And let me guess, let me ask people from our chat room, what is the appearance of a coronavirus under the electron microscope? It's a very easy question. Coronaviruses, electron
Crown,
microscope.
parang
Corona,
crown,
what? Alyssa, chat?
parang crown.
Crowns. Okay, crown-like. The crown-like
Apo.
structures is the reason why they named it coronavirus or the coronavirus family. And why is it important? Why is this particular virus important? It's actually just the causative. It's actually the causative agent of common colds. However, because of constant mutations, we have now. Oh, I didn't edit this one. Please add this onto your slides. I didn't edit this one. Uh-huh. The most recent pandemic. See, I created this. I created this slideshow during the SARS pandemic. All right. It was such a long time since I taught virology to students. So we're gonna try and edit this one now because there's two more that I need you guys to remember. There's two more that I need you guys to remember. Can you give me the first one before COVID-19? Can you give me the second one or the second pandemic in our lifetime or in our generation before COVID-19? Anybody? If you're looking at health magazines, you will see this virus come up several times. Anybody in a chat room? After SARS, there was another one, and then after that one, COVID. What was that one what's that one that I'm talking about? What virus am I talking about? Joanna virus. Virus tayo. No, 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 no. Under the Coronaviridae family. I'm talking about the Coronaviridae family. Influenza is a different virus family, ha? Ikaw talaga, Joanna, ha? uh, H2N2, no. Yeah, kape muna tayo. Yeah. Um, Adrian, hindi ka kasi sure eh, kaya hindi ko binigay sa'yo na tama.
Sir, hindi ko kasi sure, pero parang tanda ko, sir.
Oo,
Parang
eh, ba't
SARS CoV
parang
tapos
kasalanan ko
MERS-CoV.
kung hindi ka sure?
Sorry, sir,
Ano
sorry.
gagawin ko?
Pero ang pagkakatanda ko, sir, MERS-CoV po, sir.
Okay. What is MERS-CoV? You're correct.
Yung sa Middle East po, respiratory syndrome po.
Again. I want you to
Middle
be
East
clear.
respiratory syndrome.
Middle Eastern.
Respiratory syndrome po.
All right, wonderful. MERS. All right, so we have SARS, MERS, and then the last one, the recent one that we're suffering right now. Uh, Anyone? The current pandemic is caused by what? Under the
COVID-19.
Coronaviridae family. Ay, hala, nakalimutan na nila.
COVID-19
Ito
po.
kasi si
COVID-19.
Okay, very good. Akala ko na kasi naman yung mga presentation ng medical ano natin, yung nagpe-present kasi ng medical literature sa atin diyan sa Philippines, si Harry Roque eh. Kaya tuloy nahihirapan kayo. All right? But I don't have a political affiliation, guys. Actually, I'm not voting. Don't be like me. Okay? Please don't follow my ano. Practice your right to vote, especially now, 2022. And 2022, ha, wisely. Ha, 'di ba?
Yes.
Meron pa tayong ano, meron pa tayong plug. O, 'di ba? All right. Let's